Good afternoon, everyone, and welcome to our 2023 annual Pinderhughes lecture to celebrate the sustained impact of Professor Elaine Pinderhughes. We're delighted that she is joined by her immediate members of the family, and there are many in this room, but also others joining us online. Professor Elaine Pinderhughes is Professor Emerita and former chair of the clinical program at the Boston College School of Social Work. She has served as Lydia Rappaport Professor at Smith College School of Social Work, Lucille Austin Fellow at Columbia University, and held the Moses Chair at Hunter College School of Social Work. Professor Pinderhughes has received numerous awards, including the CSWE 2012 Lifetime Achievement Award. Professor Pinderhughes wrote 3 books published by Free Press: Understanding Race, Ethnicity, and Power, The Key to Efficacy in Clinical Practice, The Power to Care, Clinical Practice Effectiveness with Overwhelmed Clients, as a co-author, and Group Work with Overwhelmed Clients, again co-authored. And then in 2016, she published an edited volume called Understanding Power, an Imperative for Human Services, with co-editors Patricia Romney and Vanessa Jackson. She helped the Boston College School of Social Work establish the Diversity series, which bears her name. She continues to be rich with ideas and in our imagination as we forge ahead in this century of social work. And let me just illustrate to you, going back a little bit from Professor Pinderhughes's writing, how lucid she is and how her writing gets to the nub of the matter. She writes in Understanding Race, Ethnicity, and Power, and I quote, "How one responds to being different from others and what it means are issues that are rarely given attention in preparing people for cross-cultural work." Very relevant today. And she goes on to say, "Yet the experience of the self as different from another is important for both practitioner and client in the cross-cultural encounter." I think this summarizes her decades and decades of work and contributions to social work. There's more we will hear from her later in the talk, but let me turn to our invited speaker for this year's Pinderhughes lecture. Professor Tanusha Raniga teaches social work and community development at the University of Johannesburg in South Africa. Professor Tanusha Raniga has recently been appointed as a South African Research Chair in Welfare and Social Development at the Center for Social Development in Africa at the University of Johannesburg. She is a recipient of the National Association of South African Education Institutions Young Up-and-Coming Award and the University of KwaZulu-Natal Award for Outstanding Contribution to the School of Applied Human Sciences in the College of Humanities. She's actively involved in research primarily in the area of social protection policy and feminization of poverty and sustainable livelihoods. Her teaching areas include social policy and integrated social and community development. She is currently working on communities of practice for social systems strengthening for better child well-being outcomes. The key aim of this communities of practice work is to develop implementation solutions to improve the child well-being outcomes via a community of practice model composed of social work, health, education, and mental health professionals and paraprofessionals in selected urban wards in Johannesburg and rural Limpopo. She's also leading research testing key developmental welfare ideas in practice through an inter-country study titled Psychosocial and Economic Impact of COVID-19 Pandemic on Women Entrepreneurs, a comparative analysis of South Africa and Nigeria. Her Pinderhughes talk this afternoon is titled Developmental Social Welfare and Sustainable Livelihoods, Lessons from South African Innovations. Please welcome Professor Tanusha Raniga.
Thank you so much, Professor Yadma, for that introduction. I want to start by paying tribute to Professor Elaine Pinderhughes, and to really say that you are an inspiration to social workers all over, particularly within the Global South countries. Your seminal book titled Understanding Race, Ethnicity and Power resonates a lot with us as practitioners in South Africa, and has made a profound impact on how power permeates every aspect of our daily relationships and the helping process in particular, and working towards emancipatory and empowering practice is really a priority in South Africa. I also want to say thank you to Professor Yadma and the staff at this esteemed university, Boston College. I'm really humbled that you have graced my invitation, and that I'm visiting one of the oldest schools of social work within the US. I'm truly honored for this opportunity and to be delivering the Elaine Pinderhughes Diversity Lecture this afternoon. Thank you. My title of my presentation is Developmental Social Welfare and Sustainable Livelihoods, Lessons from South African Innovations. So I come from a very multicultural and diverse country. If you've ever visited South Africa, you would know that we are really around the southern tip of Africa. And South Africa really compromises 9 provinces. I hail from the very green province called KwaZulu-Natal. That's where I spent much of my foundational years. And now in the last 5 years, I've moved to Gauteng, which is about a 6-hour drive from KwaZulu-Natal, or an hour flight. Just to also clarify that Lesotho, what you see in the white of the map, is an independent country and doesn't make up the provinces within South Africa. So you would have followed over the last 2 decades that South Africa has a unique history of repression, which comprises 300 years of colonialism prior to the apartheid nationalist government that came into power in 1948. And yesterday, the 27th of April, South Africans celebrated 29 years of our democracy. And this has come with a combination of political and economic legislation changes, purposefully, which really stripped people within the apartheid times, particularly non-white in citizens, of access to quality education, gainful employment, and really repressed any sense of an entrepreneurial spirit. The Group Areas Act of 1950 controlled where Black people could live, what they could own, and what work they could do. The Land Act of 1913 removed property rights of non-whites, controlled residential areas, and used taxation as a means of forcing people to find paid work in the mines. It resulted in the removal of millions of people from their land, the disintegration of the family system, and displacement into native reserves, which we knew as Bantustans. This, combined with the migrant labor system, really resulted in destroying the social, cultural, and economic fabric of millions of South Africans, and the effects are still felt in contemporary times. The current population of South Africa is 61 million. And as I said yesterday, was a really milestone phase for us as we celebrated 29 years of our democracy, which really takes us back to the first democratic elections, which was held in 1994. And it was a time where South Africa experienced a shift from the apartheid segregated, unjust laws to a democratic, egalitarian society, a shift which paradoxically, I would say, took place in the context of neoliberal economic globalization. Among the structural injustices inherited from the apartheid system, we still feel the effects of high levels of poverty, dire unemployment rates, and inequality as some of the key kind of concerns or developmental concerns in our country. The existence of a socially conscious government in South Africa has placed poverty alleviation as high on its nation agenda, which was really key for us as social work practitioners. So in 1997, we had a seminal policy which really guides social work practice in the country, called the White Paper on Social Welfare. And that, together with the National Development Plan Vision 2030, really are positive policy rollouts that shows that government is really committed to providing a better life for all, and by fighting poverty and really increasing access to jobs in the country. Despite the government's poverty alleviation efforts, poverty and unemployment remains one of our greatest challenges. And I must say, over the COVID pandemic, it's really perpetuated, because those living in poverty have sunk deeper into poverty, and the gap between the rich and the poor has gotten wider. So developmental social welfare practice is a very distinctive form of social work practice. It's underscored by social development, which transcends the micro practice and adopts social investment strategies that build on people's skills and capabilities, such that they are productive citizens in society and are able to live fulfilling lives. There are 5 key pillars which we adopt as part of the developmental social work approach, and that is that practice is guided by promotion of human rights and development, and integration of social and economic development, the integration of micro, meso, macro practice level interventions, active people's participation, as well as building authentic partnerships across the social development sector. So social development encompasses the participation of multiple stakeholders in decision-making, fostering self-reliance, and harnessing of the efforts of all individuals, the development of a sound network of institutions, and the promotion of harmonious relations between individuals, groups, communities, and their physical environment. So developmental social welfare focuses on social protection and the maximization of human capabilities, tapping on untapped resources in communities, with particular focus on the causes and effects of social vulnerability and marginalization. I can say that the developmental social work approach is very closely connected to meeting the 17 Sustainable Development Goals and the Global Agenda for Social Work and Social Development, set by the International Federation for Social Work, the International Association for Schools of Social Work, and the International Council for Social Welfare. And this is the 2020 to 2030 agenda. So you can see that the pillars put forth by the global agenda really resonates very well with what we adopt as the developmental social work approach in South Africa. In the 29 years of our democracy, the most successful poverty alleviation strategy has been the expansive social security system with more than 20 million beneficiaries. So we have various groups in our society, vulnerable groups such as the older person 60 and older, children, within single mother households, as well as foster children, children with physical and mental challenges, as well as adults with physical and mental challenges, can access some cash transfer from the South African government. My research has shown that such a quantitative assessment of the state's success in terms of rolling out these social grants as a key poverty alleviation strategy provides very little insight into the costs and benefits derived by beneficiaries through such transfers, cash transfers, and to what extent that it is really sustainable. During the COVID-19 pandemic, the South African government also introduced the social distress relief grant, which is literally about $22 or $23 in US dollars. In South African rands, it's 350 rands, which is really menial in relation to the high cost of living, But unemployed individuals were for the first time, were able to access this social relief grant because of the COVID health pandemic and the crisis around that. Recording case examples and the voices of the poor as a qualitative measure perhaps will be more revealing on the impact of such state expenditure on the lives of South African citizens who are confined to the margins of impoverishment. And I'm currently involved in some inter-province kind of research to really just look at that, particularly woman-headed households and the kind of impact of the social relief grant and other cash transfers on the sustainability or the involvement of women in economic projects as well. So I'm hoping to roll out some of my papers, which I can share with you later in the year. So adopting the social development approach to welfare hasn't come with any challenges. In other papers, I argue that there has been limited implementation by social workers to get involved in income generating and economic based projects, especially with regard to women-led livelihood strategies. And I think a lot more has to happen around that in the various provinces in the country. I like what my mentor, Professor Vishanti Supal, has always argued, that the micro-mezzo level program intervention that's directed towards individuals and families and groups without attention to the macro level intervention and the structural barriers that impact people's lives serves to not only exacerbate poverty, but prevents families from realizing the goals of economic self-reliance, family pride, dignity, respect, and family independence. So in other words, if we pay attention only to the clinical and the mezzo level work that we do, without really focusing on the kind of systemic and structural problems that we're facing in society, we're really sending people that we work with, our service users, back into a disabling environment. And that's very much what we embrace in South Africa as social workers. So I'm going to shift a little bit now to really just talk about Afrocentric community-based welfare practices. Although pre-colonial communitarian welfare practices have historically promoted health and psychosocial well-being in African communities, their contributions in the post-apartheid era has been diminished or not recognized. Until 2002, when there was a kind of a conscious effort by the the National Department of Science and Technology, which really works very closely with higher education institutions in my country, has placed a lot of conscious effort on integrating Afrocentric knowledge systems and indigenous welfare practices with formal social development programs. Given the failure of development projects and persistent levels of poverty, there is a renewed interest in an alternative approach to development that emphasizes the cultural dimension of development. And I argue in many of my papers that Afrocentric welfare practices with a focus on culturally appropriate, non-oppressive, and a conscious struggle for liberation are key kind of pillars or values that we need to embrace as social workers, which has a greater contribution in social development. So a lot of my research over the last 5 years has evolved and embraced also what I refer to as sustainable livelihood approach, together with Afrocentric practice and social development. Professor Antoinette Lombard, a prominent social development scholar in South Africa, argues that developmental social work and sustainable livelihoods approach are in principle decolonial, as these theories are based on principles of people-centeredness, social justice, and human rights. Another lovely professor, a mentor of mine, Professor Hannah Nell, argues that households adjust to their physical, social, economic, and natural environments through a focus on livelihood capitals designed to protect the household from shocks during times of crisis. So some insight into some of my research over the last, since 2014 up to now, has been around women's role in the informal economy. Pre-colonial South Africa relied on women, kinship care, neighborhood kind of ties, mutual aid and community support systems to meet the psychosocial and economic needs of family members. In the apartheid era, the rise of racial capitalism coupled with marked patriarchal authority was deeply ingrained in family and community life. And we even see the repercussions and feel the repercussions of it as women in society. Women have traditionally, within the Africa continent, been the backbone of family and communal systems, the provision of food security, care, and compassion within the family system. In contemporary South Africa, women have been compelled to initiate businesses to supplement the menial kind of monthly cash transfers that they receive from the state, because it's not enough to match the cost of living. So it's heartening to know that more than 50% of unemployed women have entered into the informal economy through starting their own businesses. However, my own research has shown that despite the increased visibility of women in the informal economy, financial institutions in the private sector continue to exclude women from access to microcredit and loans. And this is a major obstacle to their long-term sustainability of their small businesses. So I've networked with a few NGOs in Johannesburg, in Gauteng, and in KwaZulu-Natal, as well as within the Western Cape area. And it was really heartening to see that the number of women engaged in businesses or entrepreneurial activities has increased, particularly in the last decade, as a result of opportunities provided by the NPO sector, and has emerged as a key developmental strategy in low-income communities, influencing public policies, societal attitudes, and socio-political processes. Social entrepreneurial activities really integrate the public-private profit-making and non-profit sectors in South Africa, and that the emphasis of this hybrid model has been the backbone of the economic development of women in the informal economy in South Africa. In poor communities, tapping into untapped community resources and nurturing positive social networks are facilitating factors that can assist women to increase income security and reduce their vulnerability to poverty. So Professor Leila Patel, a renowned social development scholar in my country, has argued that sustainable livelihood approach is perceived as a means of improving livelihood outcomes of the poor through increasing income, strengthening social networks, improving resources, and opportunities for a more sustainable household. More recently, in the last 18 months, I've explored value chain development, which really emerged during the past 2 decades in global South countries as a community-based economic strategy to meet poverty-related sustainable development goals. The priority has been to enhance local and global responses and to strengthen mutually beneficial partnerships within the social development sector. So some prominent researchers state that the focus of value chain development is to create and build trust among value chain stakeholders, to extend and or improve production operations and generate social benefits through income and employment generation. So what does this all mean for us as social workers? Well, for mainly within the South African context, and I can talk about work that I've done in the SADC region, which we refer to as the Southern African Development Corporation countries, comprising Botswana, Zambia, Swaziland, Lesotho, Zimbabwe, as well as Malawi. There's a clear kind of a conceptual synergy between a sustainable livelihoods approach, indigenous practices, and developmental social work. This is enshrined in the developmental social welfare approach in South Africa, where social workers who work in rural and low-income communities within urban areas are encouraged to set up social enterprises to improve social and economic functioning and reduce gendered poverty. Many value chain initiatives entail a range of community-based economic activities, which include linking entrepreneurs with organizations from NGOs, government, and the private sector in order to facilitate access to goods, marketing, distribution of products to their customers. However, one of the major challenges that we face as social workers in South Africa has been the unequal power relationship that kind of characterizes the partnership between the National Department of Social Development, which is the key government organization that really rolls out the welfare and social development in the country, and the NGO sector or the NPO sector in the delivery of developmental welfare services. I'm really sad to even share with you today that at the moment, my colleagues who work in the NPO sector are really lobbying together to fight against the cuts in subsidies that has been really announced by the minister, like within the last 3 days in our country, and social workers within the NPO sector really have a high risk of losing their jobs, and also NPOs closing down. And historically they've filled in a gap of services in the country where government doesn't go. So social workers acknowledge that economic development that does not provide opportunities for productive employment of people and does not consider how the intersections of race, class, and gender influence people's access to status, privilege, and power will limit social development initiatives. The social development approach aims at collective empowerment, facilitating processes that help the poor, vulnerable, and marginalized to regain control over their lives. So some of my concluding remarks are that the community-based economic strategies employed by many of the women that I've worked with in various research studies to promote family well-being in South Africa really provides empirical evidence of how women can tap into their human capabilities, social capital to enhance income security and child well-being outcomes. I value that, I argue rather that community-based social development, livelihood capitals, and value chain development can provide innovative interventions that social workers can integrate to reduce poverty and economic insecurity, particularly in female-headed households where I've focused a lot of my work. Communities, in South Africa have shown to really organize to drive the developmental process themselves by identifying needs and mobilizing existing strengths and assets to respond appropriately to their developmental needs. And these can be drawn from their localized context in terms of knowledge, skills, and resource. The challenge I feel firmly about is that it lies not just in social workers having to make critical choices to reposition themselves and to reflect on their roles as developmental social welfare agents. What is really needed in my country is really a radical transformation of the welfare system and changes to structural and economic policies that disadvantage both social workers and the poor and vulnerable in society. So what I would like to see is a National Social Development Act that's really legislated to uniform social development and that takes into account the Constitution and the Bill of Rights and ensures that developmental social work services are protective and integrate social and economic goals and are preventative. There is a need to develop authentic partnerships among stakeholders in the social development sector. It should make provision for a social protection system that connects beneficiaries to livelihood strategies in line with the global agenda pillars and the 17 Sustainable Development Goals. So I'd like to end with a quote by Nelson Mandela. To be free is not merely to cast off one's chains, but to live in a way that respects and enhances the freedom of others. And I'd like to say thank you very much for listening to me and for this opportunity.
Dr. Raniga, thank you so much for your amazing presentation. That was great, and I think maybe it's probably better.
Would you like me to stand?
Yeah, I think
Okay.
just for the camera purposes.
Sure.
Yeah. So again, I would like to thank you for your presentation, for enlightening us with all these information about South Africa and everything that's happening there. I think one take-home message is the fact that definitely there is a lot of work that still lies ahead, not only in South Africa, but also in several countries abroad, and particularly here in the United States. So to kick it off, I would like to go ahead and ask the first question, and then I will invite others in the webinar to ask more questions that you may have, because I'm sure everything that you mentioned has sort of sparked so many questions among us. So I just wanted to hear a little bit more, and I was wondering if you could please tell us more about how you use Afrocentric theories and indigenous knowledge in your own research, and if you can give us an example of that use.
Sure. Okay, so Afrocentric scholarship or perspective really just espouses culturally appropriate, and as I said, non-oppressive, liberating research. So it's very much what we would connect with as participatory action research. You know, it's very involved. It's really, there's no hierarchy between the researcher and the participants involved in the study, and that it's really protective of the needs of participants in communities. So a lot of my work has looked at uniquely valuing local knowledge, valuing the pace of the community, so the local processes, valuing the local strengths in the community, acknowledging the capabilities and the local skills that are so rich in communities, and tapping on that to really involve participants within the research. And it's I've done several work that really shows that it really results in a very taking an indigenous lens in the entire research process really aims to influence transformative action and promotes social change, you know, at various levels, from the individual to the groups to communities, families.
Thank you very much. Lindsay, are there any questions?
We do. So we have a couple of questions in the chat. The first one is, who are some of the adversaries to this sort of developmental approach to the social development approach? And then how are the proponents and adversaries kind of engaging with one another or are they engaging with one another in this kind of productive struggle?
Okay, that's a good question. So we know from in the post-apartheid era, taking in a lot of the old kind of organizations and systems into a new democracy was not easy, you know, and like Professor Elaine Pinderhughes very rightly argues that power relations permeate every kind of facet of human relationships, particularly within the helping professions and the social development sector. So evolving within the first decade was quite a challenge, because it meant really putting together an integrated welfare system, taking 14 different departments and bringing them under one umbrella department. Didn't come without any sense of disparities in power relations. So I can say 29 years later, it's gotten a lot better. So there's not adversaries as such. People embrace social development, you know, within the national social development department, and have made concerted efforts for social workers to really reposition themselves and reorientate in terms of their training. You know, and there's been numerous conferences and opportunities for social workers to increase their knowledge and their skills base in terms of embracing developmental social work. My worry now is that the kind of power relations that existed historically in the NPO sector and the social development department, the government sector, is really now coming at a loggerhead, and so that's where I see the main kind of tensions.
Another question is, you mentioned that women make up a significant amount of the informal sector, and that they're developing their businesses and things like that. Yet they're not really getting private capital or these microloans.
Okay.
Can you say a bit more of what types of businesses they're developing and why do you think they're not getting sort of the microloans or being able to be engaged in that private piece?
Okay. So most of the women that I've worked with have been informal traders. So they really just running a catering business from home or selling fruit and vegetables on the roadside, as street vendors. And so during so that has been mainly the focus. There's two kind of parallel groups that are within the informal sector, people that work on contracts, part-time, so less than 40 hours a week, are also considered within the informal economy. And then there's those that are informal traders, that are trading whatever, it could be, as I say, food items and baked goods that they're making at home, or fruit and vegetables. And that has been mainly the group of women that I've worked with. Within these two categories in the informal economy, they do not pay tax. They're not tax-paying members in society. Secondly, they do not have any labor protection because they don't have any formal contracts with the people that they work with, So, for example, if a lady is a mother is working as in a creche, in a daycare center, caring for children, she's doing it purely on trust that she's going to get paid every month. There's no kind of formal contractual obligation with the employer. I hope that answers some of your.
Yeah. Are there any questions here in the room that?
No, there's one.
We've got another one in the chat, unless Carolina, you want to go?
Yes, thank you so much for this wonderful presentation. I was thinking as you were talking about the challenges of training social workers in this macro level aspects. And I was wondering if you can share a little bit about how social workers are trained there to maybe enlighten us in terms of how we can do this.
Thank you for that question. So in South Africa, social work is a 4-year undergraduate program. 50% of our degree is really consciously practice-based in relation to theory. So we try and very closely and intentionally include the social development approach to welfare right from first year as the key kind of conceptual theory that guides our training. More recently, as I said, from 2016 onwards, there's been a lot of focus and emphasis now on what we call decolonial social work practice. So decolonizing the curriculum. And that means that what we've done as academics is to really consciously include a scholarship that's written from Africa, So there's a lot of, like I quoted, a lot of the prominent social work scholars in my country. We've also included, social workers from across the continent. And it's been like 80% of your prescribed readings and your must be from African scholars, because of not wanting to reinforce the kind of hegemonic relationships that we've had, especially in relation to scholarship from the West and global North.
But could you speak to the graduate programs? You don't have any
Yes,
graduate programs?
We do. So we have a master's in clinical practice, and we also have a master's in community development. We also offer, where I am now in the CSDA, a master's in social policy and social development. So this is more multidisciplinary with the social policy and social development. So it's not exclusively for social work graduates. But the clinical practice masters is only selected in for social work graduates. And the masters in community development is really also very integrated, multidisciplinary. So it's over a 2-year period. If students register full-time, yeah, then they can complete within 2 years. If they are working, they can take up to 6 semesters. And it really means that they have to do a practice internship that gives them hours that they have to complete as part of the training. And they also have theory modules that they go through and a research component that they have to submit.
Thank you so much for your presentation again and for enlightening us.
Pleasure.
I would now like to hand it over to Professor Pinderhughes.
Professor Pinderhughes, the floor is yours.
You're still
You need to
muted.
unmute. Thank you.
Can we unmute?
There's-
There's Rick.
Hi, Rick.
Okay, now you can.
Excellent.
All right. Thank you so much for continuing this wonderful lecture series that explores themes that illuminate a broad range of diverse studies research. I am truly honored to hear these presentations made in my honor. Doctors Braniga and Piñeras Leano are effectively continuing the kind of social work research that I valued throughout my career. I've learned a lot from them today. I am especially interested in the question about social security, sustainability, and the measures that would make that sustainable. I wonder if you can define what the informal economy is so that I could understand it.
Sure, thank you for your question. The informal economy is really made up of people who cannot get jobs in the first economy, you know, where you are tax-paying members and you get a consistent salary every month. So in my country, the informal economy is really defined as those that work on contract, those that are really, you know, don't have any employment, formal contracts with their employers, they're not tax-paying members, and more particularly, they are, you know, they work less than 40 hours a week. I hope that answers your question. Is that okay?
Professor Pinderhughes, any other questions, comments?
I think that I very much appreciate the opportunity to hear about this work. I'm very impressed with it. And I think that's about all I have to say.
Well, thank you for that very important question, because the informal economy, not only South Africa, but a lot of the low and middle income countries, large portions of the poor survive because of the informal economy. And I think there's an area of practice, particularly for our social work students that are going into global social work practice or even otherwise, to really work in the informal sector with such populations. A couple of examples, Professor Pinderhughes, just to further elaborate, that I'm familiar with. In the case of places like India and so on, there's social workers are working actively in informal housing sector, because a lot of this informal economy is also overlapping with housing, because there's squatter communities that are not recognized by municipalities that we see across Asia, parts of sub-Saharan Africa, and many parts of Latin America as well. And I think this is an area of practice for community development folks, as well as those working from social work in the housing rights and social policy space. So I think, Professor Pinderhughes, your underscoring of the informal economy is right on point. And thank you so much for highlighting that aspect. And I want to again, once more, thank Professor Raniga for her talk this afternoon. And I want to say to Professor Pinderhughes that we look forward to seeing you hopefully again, not only in between in the school, if that's possible, but I will come to see you, and we will see you in 2024 at the annual Pinderhughes lecture. And in the meantime, you keep us inspired and motivated to do the best work, Professor Pinderhughes. Thank you so much from all of us. And I think with that, we will conclude this afternoon's Pinderhughes lecture. And thanks to everyone for attending it. Bye.
Thank you.